Hi, I'm Chris Christenbury, and we're here with Dr. Andrew Shaw, who is a psychoanalytic psychotherapist, a psychiatrist, and we're going to talk about, well, welcome, Dr. Shaw.
Well, thank you. Thanks for having me.
Hi there, you're here too.
I am.
And we're going to talk about what a patient can expect during the initial phases of psychotherapy.
Well, the beginning is much more active on the therapist's part. What the therapist is really trying to do is gather a lot of information about the person's presenting problem, why they're here now, why they're in the room, but then is also spending a lot of time gathering information on related issues, such as any past psychiatric history they might have had or experience in psychotherapy, medical treatments, any possible related substance abuse, family history of mental illness, and then as a psychoanalytic psychotherapist, what is really important, and this often will take another session, is the person's background. Because in psychoanalytic psychotherapy, that's all about understanding the paradigms and the way people think based on their experiences in the past. And the importance of that is we're not trying to go to the past just for the past's sake, but the experiences that people have had in the past are often overlaid in the present. And so the first part of psychotherapy, again, in a nutshell, is to take a lot of history, presenting problem, medical issues, related issues, and then a big segment is where does this person come from? How did their family operate? Did they have any traumas? What were their relationships like with their mother, their father, their brothers, their sisters, their peers? All of that information is really important because it lays the foundation for then what happens next. Psychotherapy is not about evaluating or judging in that way. It's not about giving advice. It's about a journey between two people in a trusting relationship. And it's really important to understand where that person comes from. And I will, to answer your question, yeah, it's that piece is, that part of the therapy is really critical because often as patients may be sharing with you very tender, very difficult emotions, your response to that can build trust. And again, this is where, again, I talked in our first video together about the importance of the therapist training. In my work personally, I've faced a lot of different emotions, and I've become very familiar and friendly with them. And so if somebody's really sad or deeply grieving, that's an emotion I'm familiar with and I'm comfortable with.
And you have the ability to be empathetic with the person, but not get enmeshed in it.
Exactly. When you have worked through your emotions as a therapist well, what it helps you to do is connect with that patient and that feeling. Because that feeling is no longer so frightening that you have to get away from it as a therapist. So you can kind of join the patient in that emotion. At the same time, there's a part of you that can kind of stand back and listen. You don't get sucked fully into the emotion, but you can empathize. And a patient can feel that, and when you're accurately empathizing or you really understand the emotion, you often quite naturally say or do things that the person understands, that you're at least listening deeply and that you do understand. Mm-hmm. And that forms the trust that the rest of the therapy functions with.
Yeah. As you were describing that, I thought about the function of a sea anchor. A sea anchor is a device you throw over the back of a boat that fills with water, and it pulls the back of the boat so that the bow is always in the direction of the oncoming waves.
Interesting. Yeah.
And you as a psychotherapist are going to be able to help steer the patient so that he or she is always focused on where things need to go rather than something that's not going to work for them.
That's a beautiful metaphor, because I do see a therapist's function as primarily that, is a guide, an assistant, helping a person move towards the things that are really going to help them in psychotherapy and
Right.
to help them understand themselves.
Be-
So,
Because free association is a very big part of psychotherapy. So allowing the patient or encouraging the patient to talk about whatever's on their mind is important.
well, as usual, my colleague is a little bit ahead of me.
Sorry.
Actually, it leads right into the second phase of psychotherapy. The second phase is, as you highlighted there, is much more open. So once a therapist has some kind of tentative ideas about what this person's take on life is, what the paradigms are that they might hold, and at that point they are theories. They're not written in stone. But the therapist has been trained to listen carefully and to maybe have some theories. Then the patient is encouraged to, as you said, free associate. So what does that mean? This is where psychotherapy is also a bit different than any relationship you've had, because most people are familiar with social interaction. Is the therapist at that point lets the patient go wherever their brain goes. They're listening very carefully, and the reason free association is so important is because the brain works by association. So if 1 minute the patient is talking about their mother, and then they shift to an experience they had at work, those two thoughts are connected.
Have to be connected somehow.
We may not know how right then, but a therapist knows that any thought that follows another thought, which then follows another thought, is connected. And another way to think about a therapist is he's your friendly detective. He's your ally. He's not trying to catch you in something, but he's trying to piece together a puzzle, and those associations help him to piece together what is the thread that holds those associations together. And in that way, a therapist begins to help a patient to see their thought patterns. And, for instance, in my example, whatever it was that was concerning them about their mother, that something about that might be related to how they're experiencing their work.
Mm-hmm.
And a therapist will help a patient make some of those connections. So another misconception about therapy is the therapist may influence you in some way. You're not trying to get a patient to believe anything or try to steer them towards something. You're trying to help them discover what it is, what their paradigms are, what the ways that they do think about relationships, so that they can kind of stand back and decide, is there a different way of thinking about this? Is there a different way of approaching this particular problem?
So if I hear you correctly, it sounds like you're saying the best way for a patient to have a problem solved is for the patient to solve the problem himself.
Absolutely.
And you're just going to throw the food in there that needs to feed the right decision.
Yes.
And when they choose a decision, let's figure out how this is going to be a healthy decision for you or an unhealthy decision for you. But they figure it out.
It's theirs to own.
Right.
That's not to say that a therapist will never give advice. I mean, sometimes a patient may be stuck and is really struggling with a very important problem or issue, and I will say that a therapist would always offer advice tentatively. It's kind of like, from what I've gathered and what I'm hearing, this might be helpful.
Right.
But you can never completely know everything about a person and their situation, because you're not at work with them.
Mm-hmm.
So advice is, again, I just want to highlight that advice is not really the core issue in therapy. A lot of people, again, have that misnomer that they're coming to some expert and they're going to get the right.
And in 7 sessions, we'll solve this problem.
Yeah, right. So, it's more about as you said, helping the patient come to their, really knowing their emotions, knowing what triggers them, and finding new and more effective ways in dealing with their emotions.
Well, that brings me to the question of long-term versus short-term psychotherapy. What's the difference, and is one more valuable than the other? When is one more appropriate than the other?
But we could talk about that for hours, but I'll try to sum it up to say, in general, a long-term psychotherapy is really about addressing really well ingrained personality patterns. Patterns are issues that people have had for years. For instance, I had a patient consult me, that had been married numerous times and seemed to have the same problem in each relationship. So those very well entrenched problems often need long-term therapy so that we can really get at the roots of that.
Mm-hmm.
Short-term psychotherapy is more for the person who's probably functioned fairly well for most of their lives. Relationships have been pretty healthy, but there's this circumscribed problem. And because they've got a lot of their own emotional tools and resources already built in because they've had successful relationships, you can do some work in a brief period of time. So I saw a man about a year ago who had a 70-year relationship with his wife, came in after she had passed, was very obviously distraught, upset, said that she was his best friend, and they had a wonderful life together. The sole issue was near the end of her life, he had to make some decisions about medical care, and he was really anxious and felt very guilty about, did he make the right decision for her. He had a long history of a good relationship. He had this circumscribed issue, and we talked about it for probably 2 months, and he really recovered, bounced back. And not that he was through his grief over losing his wife, but this issue about the guilt related to some of
He was able to deal with it.
He dealt with that, and he moved on.
Yeah.
So that's a good example of a short-term psychotherapy.
Great.
I'll just mention that the last phase of therapy is what's called termination. And really what that is about is once somebody has really worked in therapy for a period of time, has practiced their new paradigm, so to speak, has really felt that they're interacting much more effectively with other people in their lives, and they're not having the symptoms that they came into the office with, then you enter in formal psychotherapy what's called termination, because if the therapy has been really good, the relationship with your therapist has been very important, life-changing, and stopping is a little
It's
bit
like a divorce.
It's like a loss in itself.
Yeah.
So we don't end in one session and say, "Oh, it's been
Have a
nice
nice
seeing
day,
you."
yeah.
There usually needs to be a period of time processing what the therapy relationship has meant, and grieving, and saying goodbye.
Mm-hmm.
And I will say, in a good psychotherapy, a therapist, has very powerful feelings
Sure.
during that phase. You've really been engaged in a very deep relationship with this person. So, but because of the training, it's not that we don't always share those feelings with the patient. Sometimes we might, but it's a real process that both the patient and the therapist need to go through. At its core, therapy is a trusting relationship in which there's a journey towards emotional health, but along the way, sometimes that trail can be a little scary, and a therapist is there to help guide and to help the patient work through those issues. But in a nutshell, that is what you can expect in psychotherapy.
Well, thank you. I appreciate it, and I'm looking forward to one of the next videos that we do about the plastic brain.
Yeah, neuroplasticity.
Yeah, I'm excited about
And we'll
that.
also, for good measure, throw in there how mindfulness is a part of that.
Absolutely,
All right.
absolutely, it's important.
Thanks for joining us, and we'll see you next time.
Super.